So welcome everyone to our launch event for Run Free. I'm delighted to welcome you to this event, particularly special to be holding it today, World Clubfoot Day, which also marks the anniversary of Dr. Ponsetti's birth. And what better day to come together to launch this global movement aimed at transforming the lives of children born with clubfoot around the world. Run Free represents our collective vision for a world where every child born with clubfoot has access to treatment. Today, we have a very exciting programme lined up for you, featuring insights and contributions from colleagues and advocates from around the world. And we're very grateful to all of our speakers for joining us today and offering those insights. Before I move on, go introduce you to our first set of speakers, just want to go through a few housekeeping points. So the webinar is being recorded today and will be circulated afterwards to everyone who's registered. Participants are automatically muted, so to reduce background noise, and there should be a live transcript if you click on the CC button on your screens. And although we won't have time for a Q&A session in this hour and a quarter, we would love you to ask any questions and use the Q&A function again on your screens, that you can pop your questions in and our panelists can respond on as we go through the webinar. So in our first session today, we'll be hearing from Maggie and Esther. I'm not going to say anything more about them at this stage, and I'm going to leave it to them to tell you their story. And then following on from that, Ros Owen, our Global Clubfoot Initiatives CEO, will be telling us more about the Run Free strategy and our ambitious goals for the future. And thank you everyone for joining us today and for being part of this crucial movement. Your support and participation is what makes initiatives like RunFree2030 possible. So without any further ado, I'm going to pass over to Maggie. Maggie, over to you.
Thank you, Catherine. And thank you to everyone and welcome everyone. So let me first introduce myself in case you don't know who I am. I am a former athlete, and the sport that I used to play is rugby union, as you may have seen based on this beautiful picture of myself. I represented my country, which was England, 74 times over an 11-year period. And now you're probably sort of trying to wonder why I've been asked to come and speak. Well, I was born with a club foot. My right foot was turned all the way in. And when I was young, I had corrective alignment surgery at a very young age to I guess, straighten my foot. And I guess my journey kind of started from there. I was really unaware the fact that I had club foot growing up. I knew that my foot slightly turned in. I didn't run like everyone else. My shoes, my right foot in particular, would wear away fairly quickly. But I didn't think too much about it. I grew up in a single parent family environment on a council estate, very deprived area. My mother grew up in Nigeria, gave birth to me over here in England. Moved to England before I was born, and I guess my mother didn't feel the need to share that information with me growing up, so I just kind of I just got on with it. And it was really interesting throughout my whole childhood, secondary school, through to obviously university, etc. I basically just did sport. I absolutely love sport. I didn't think about how I ran. I didn't think about how I may be slightly different to everyone else. I just enjoyed sport. At primary school, I did netball, I did rounders. At secondary school, I did every sport you can probably think of. In particular, football was one of the things I absolutely loved. And I'll be very honest with you, I am an Arsenal fan, so don't hate me for that. But I really loved sport. But there was one point in my life that really changed, which I owe a lot to this one individual who guess kind of saw the strengths in me, regardless of, you know, how I ran or again, my behavior as well, because I was quite a challenging child at school. And I want to show you this individual. So Catherine, can you turn to the next slide, please? So this woman, her name's Lisa Burgess, was the person who pretty much changed my life for various different reasons. So she basically suggested that I play a sport called rugby union. And growing up in North London, rugby union was not a popular sport. Rugby union pretty much wasn't a sport that I guess you would associate with a lot of people in that part of London. And she said, look, try the sport out, give the sport a go. And that's what I did. I actually listened to my teacher and I went down to my local rugby club and I picked up the ball, made my first big run, my first big tackle, and I absolutely loved it. And it was one sport that I basically didn't look back, because it's quite funny growing up at school, you know, again, having my foot, I guess, slightly aligned in a certain way, which affected the way I ran, my gait. I was really conscious about doing things that was public. So I struggled when it came to doing a school sports day, you know, running the final leg of the relay and thinking that people are going to watch how I run and I'm going to run slightly different. But again, I just got on with it. And when I found rugby, what I loved about rugby for me was that everyone was very different in different ways. And for me, what it did do is it enabled me to really focus on my strengths and the things that make me special. So she got me into rugby. I took up the sport and I never looked back. I set my first goal, which was to play for England. And at the age of 19 years old, I got the phone call from my England head coach who said that I'd been selected to represent my country. And it was really interesting throughout my whole entire time as an athlete at the elite level. I was pushed under high demands of training, you know, having to compete with many other athletes that obviously didn't have the same start in life that I had with my club foot. But it was really interesting. I only really came to my conclusion that I had clubfoot was when my England doctor spotted that I had quite a big scar on my right Achilles, and obviously was very aware of the way I ran. And she was like, this is what you have. This is what you was born with. Did some further research with my mother, and she made it very clear that I had clubfoot. And it was really interesting because it was one of these things that it never held me back. And sport was probably the big defining thing for me that enabled me to be the best version of myself. So I kept doing my sport. I had worked with my strength conditioning trainers, lots of rehab, just to manage my mobility. I did a lot of work on strengthening my calf, my quads, and actually enabling me to be the best athlete that I could be. I went to one Women's Rugby World Cup. We got to the final against New Zealand and we lost. I went to another World Cup 4 years after that against New Zealand again, annoyingly, and we lost. 4 years after that, went to another Rugby World Cup. This time, this World Cup was in 2014. It was in France, and we played against Canada. And thankfully, the score was slightly different. This time, we won. Catherine, I'd like to show you, if you can send the next slide. This is my England team winning a Rugby World Cup. And you can see me on the far corner, should be on your left-hand side. But this is me winning a Rugby World Cup on a 12-year journey with my England team. And I show this picture because I show it to lots of people, especially I talk to families, I talk to people who have started with that journey with Clubfoot. And I really emphasize the fact that the journey wasn't easy, experienced adversity, but the key thing was, for me, I utilized sport as my outlet. It enabled me to strengthen parts of my body that probably were slightly fatigued and weakened as a result of it. But I just kept moving forward and never stopped. And as a result of that, with my England team, won a Rugby World Cup. And now I aim to be a role model for many others that have had the same start as which I've had. And I continue to be an ambassador for you know, Clubfoot. And now my journey has slightly changed. I now work as a broadcaster, talking about men's and women's rugby on the TV. But my big goal is to be that ambassador, to lead that change. And I'm really privileged to be part of this campaign, you know, RunFree2030. I want to make sure that we can enable all young people to be able to feel that they can walk, they can play, they can run, they can do the things that they never thought they were able to, but be the best version of themselves, but also help and support the families too. And so I guess I want to end with a final quote, because I appreciate it's a short time, but I want to end with a final quote. And This quote, Catherine, if I get you to next slide, please. Thank you. This quote is a brilliant quote because it's something that sort of defined me now in terms of my mindset, my attitude. And I'll read it. Be the change you want to see in the world. So I was always told, if you don't stand for something, you stand for nothing. And for me, my driver, my purpose is to lead that change. And we have the privilege to do so. So I guess what I want to say is thank you to everyone that's on this call. You know, we continue to work together to collaborate to ensure that we can create this change, and also give every family, every child that is born with Clubfoot the chance, the opportunity to be their best version of themselves, but to most importantly thrive. So thank you to everyone for the work that you do, but thank you to everyone for being part of this campaign. Thank you.
Thank you very much, Maggie. What an inspirational way to start the launch of RunFree. Thank you so much for joining us. Right, over to Esther from Tunu Africa now. I think I maybe saw Tunu.
Yeah. Thank you so much, and happy World Clubfoot Day to everybody. It's such an honor to go after Maggie. My goodness, your story is wonderful. And as a parent to a child who has Clubfoot, it's really, really so warm and welcoming for me to be able to see what Tunu's future is going to look like in the few years to come. As I introduce myself, my name is Esther Masika. I am the founder of Tunu Africa. We are a non-governmental organization that is based in Nairobi, Kenya, and we advocate for birth defects prevention, detection, and early treatment. And this whole journey began with the birth of my daughter, Tunu, who in 2019 was diagnosed at birth with bilateral clubfoot. And you can imagine this, being a first-time mom and trying to, get into grips with, what is a birth defect, what is bilateral clubfoot, and just, almost immediately, you become a mom, you become a doctor at the same time, trying to figure out what is this thing, why wasn't it detected a bit earlier. I felt so unprepared for the entire childhood and parental journey that has just begun. But as you research and everything, you find that Clubfoot indeed is a correctable disability, and that to me as a mom spelt a lot of hope. And I was like, okay, right, Esther, get it together. This girl is depending on you to be able to make the right decisions for her. And even as I looked for the support groups and everything, what really was disheartening at the point was a lot of the groups were not in Kenya. A lot of the groups were in the UK, in the US, and they had because they clearly talk about disability. It's not something that in Kenya really you find a lot of people who have shared their stories out there to talk about and to break stigma related to birth defects, and in this event, Clubfoot. So they're the ones who told me, hey, this is the thing, it's correctable. You just need to go on a 12-week journey. And it's something that we embarked on with the doctors immediately after Tunu was born. And but along the way, we had a lot of relapses that were going on, and they couldn't determine what exactly was the issue with Tunu at the time. It wasn't until 6 months down the line that we got to find out that she actually has an underlying condition known as arthrogryposis, and that really threw a spanner in the works, because there are very rare cases of that in my hometown, and that in itself changed the nature of the clubfoot that Tunu has, from idiopathic all the way till syndromic. So we had our challenges on there, but the stakeholders who deal with clubfoot in Kenya really were really helpful to us, and came on board with HopeWorks there, with Cure there. They took on Tunu's case, and we were able to determine what's the best pathway that we can use for her case. And Ponseti really came into play at this point, because we had to begin this afresh. And today, she's a 4-year-old bouncing baby girl who just eats life with a big spoon, never loses her smile. And you get to find out that the parental journey, even raising a child with a disability, is something that, today platforms like this highlight, because the mental state of the parent needs to be correct for the right decisions to be made, for us to have the child at heart, for us to be able to make decisions with the best interest of the child in terms of positive outcomes. And today she's able to live a life of quality. She's now school going. And you find that even with her beginning her schooling, there was a challenge there because obviously her disability is visible, and most schools in our hometown were just like, they're not in a position to take her on. And you find that there's certain barriers that have been put in place that make it very difficult for parents who are raising children with Clubfoot or any other disability to join schools. So, I'm just so glad that conversations like this are being held today, because indeed their future is in our hands. Tunu's future is in our hands. How we treat, how we go about creating more and more access to healthcare, more access to education, broadens the path that they can take, be it in sport like Maggie has just shared, or in whatever it is that the child chooses to do in the future. So it's very evident that we still have work to do, and as Tunu Africa, we continue to partner up with Miracle Fit and other players here to ensure that we leave nobody behind. Definitely need to keep on pressing on, especially with countries that are in low and middle income countries, to just be able to reprioritize birth defects, because amongst the issues that I've had really that have been leading to her relapse has been the ultimate care. So you've got the Ponseti treatment that happens for the first 8 weeks, and then she moves on to the buy-in brace, and then you find out the maintenance of that in our hometown country becomes a challenge, especially with the quality of shoes that we have on there. You don't know whether they're creating more problems or solving the problem that you're trying to, address at the time. And then you also have things to do with the parent. The parents do need support. It's not an easy journey having to watch your child wearing the buy-in brace for 24 hours. A lot of people have to sort of give that up. Because parents need to go to work, and you find a situation where now you've got all the therapy sessions that are in between, and you find that there are a lot of workplaces that just don't understand why is the parent, why are you always on off? But really it's because we want the best for our children, and we need to be able to continue to shed more light on this so that it's less stressful for the parents or the caregivers who are taking care of these children. And lastly, even as we look at the support systems that are here, I mean, just my experience right now, just coming to the UK, it was wonderful how they received us right from the airport all the way till immigration, all the way till I was done with the airport. And I was like, there's systems that are working here. And it could be that in our hometowns, we do have the correct strategies and everything, but the implementation is just simply not being done. And I thank God that they are in the UK, we've got working systems that we could be able to borrow a lot from, in terms of how it is from point A to point B. The child is treated from when they're 0 to 5 and 5 years and above. What are some of the things that we need to do to avoid the relapses, to avoid lifelong disability for the child? And obviously also in Kenya, the cost of treatment is so high, and there's really a need for us to continue to amplify our voices, because Ponseti, as we well know, is non-surgical, and that makes it a bit more affordable. But you find in places like Kenya, where I come from, the issue is not really that the treatment systems are not there and the treatment centers aren't there. It's just the access to the treatment centers that becomes a problem. So you find awareness will be done in terms of the road shows and going from county to county, but you find a lot of families are not in a position to keep on each week going for that treatment. And this is where Tunu Africa now comes in and tries to provide access to the healthcare facilities by offering transport and things like that. So, we still have a long way to go here in Africa, and we are super excited to be joining hands with you just to amplify what it is that we're doing from the Western side all the way till the African countries, so that it goes down all the way till that child who's seated in the village with the parent wondering, what do I do with them? They're not just a person who needs to be neglected. No, we just need to continue to spread awareness so that the child gets access to treatment as soon as possible. So for me, really, it is just for what it is that you're doing on ground, and to look forward to a better future with really child at heart. Thank you so much, and happy World Clubfoot Day.
Thank you so much, Esther. It's been fantastic to hear from you. We've heard a lot about you, so it's fantastic to listen more to you. I'm going to move quickly on to Ros now, who's going to introduce us to RunFree and the key points of it.
Fantastic. Thank you so much to Esther and Maggie for sharing your incredibly inspiring stories and using your lived experience to support this global movement today. It's just so great to have you on board sharing your stories. So I'm going to be talking us through the RunFree2030 global strategy for how to scale up access to clubfoot treatment worldwide. And we're incredibly excited to be relaunching this today, along with all of our members. RunFree2030 is not only a strategy, it's also a campaign to raise the profile of clubfoot globally, and a growing movement which is gaining momentum rapidly. And it's been incredible to see that happening even over the last few days. And before I start, I must thank lots of people. I would like to thank all of the people who have supported RunFree2030 online today and in the run-up to this launch. If you've signed our statement of support, thank you. We're nearly at 500 supporters. We'd love to double that by the end of the day, and we'll be sharing the link to that shortly. We even had Sir Mo Farah tweeting this morning about RunFree2030 to his 1.4 million followers. So let's all go onto X and retweet that now. Sir Mo Farah is an Olympic running legend, and it's absolutely fantastic to have him adding his voice to our efforts. I want to thank the GCI team who's worked so hard to get everything ready for today. It's a global strategy document with all the detail that contains a campaign, a video, a new website. They've done an absolutely outstanding job. And thank you to our board of trustees for supporting us every step of the way as well. A very big thank you to all of our members who do the incredible work of supporting the treatment of thousands of children around the world every single day. And they do it with such passion, commitment, and the highest standards of excellence. It's only because of them and the fantastic work that they do that we can even be here talking about scaling up access to treatment worldwide. And many of our members have also supported us in the process of putting this strategy together with their years of experience and their wealth of experience in what they do so well around the world. And finally, last but definitely not least, thank you to all the parents and families and people living with Clubfoot who have had the worldwide vision to support this cause. Your voice in our movement is really a driving force. So RunFree2030 at a glance. RunFree2030 is a vision that all children born with clubfoot will get the treatment they need to be able to walk, play, and run free. And our goal is that we will reach all children in every country with this life-changing treatment. And today we'll explain a bit more about our next milestone goal, which is by 2030, we want to reach 50% treatment coverage. And we'll be talking today about how we can get there. And also you'll be hearing some really inspiring examples from different countries on the work that they're doing towards that goal. But for now, we'll move on to the next slide, please. And I want to, oh, sorry, is there a slide with some pictures of two boys? Okay, should have been my first slide. That's okay, I'll just tell you about them. So I want to tell you about two boys with very different stories. So these boys, I've kind of combined a few different stories that I've been told over the years. These stories are unique to them, but have also been repeated countless times around the world. And if we're able to find those pictures, Catherine, while I'm speaking, that would be fantastic. Thank you. So the first boy on the left is a boy who's grown up with clubfoot that has not been treated. And when he was born, his parents saw his foot condition and despaired of being able to do anything about it. The health workers in the center where he was born didn't know what to do either, and they didn't give them any details of where he could be treated. They gave him a name that meant he who will not amount to anything. So that identity was almost set from the very start. He grew up with his foot deformity getting progressively worse. He was constantly teased about his feet by his siblings and other children. He wasn't able to walk to school and get the education he needed to get a job later in life. He didn't want much, he just wanted to be able to do the other things the other kids did, to wear shoes, run without pain, ride a bike, walk to school, and go to school without fearing being bullied all day. When the second boy was born, his parents were told by a health worker who'd been trained by a local organization that he had clubfoot and that treatment was available in a clinic nearby. They started the Ponseti treatment when he was a tiny baby. He had a few weeks of serial manipulation and casting of the feet, Achilles tendon releases, and then wore a foot abduction brace during sleep time until the age of 5. It wasn't easy, but they managed it because they had the hope of a better life. And now, as you can see, or maybe hopefully you'll see it soon, all he wants to do is play football. And there's just an incredible picture of him kicking a ball towards the camera. So the two very different stories of very different outcomes in these children's lives. And it seems like it was just dependent on where they were born and whether the local community had the knowledge they needed to be able to refer them for treatment. So the first boy on the left was eventually able to get treatment. He heard about it from a friend who also had clubfoot, and one day arrived back in the village after being away attending treatment for some months. She told him, "You must go and see the same doctor I saw, then your feet will be straight like mine." He begged his parents to take him until they managed to save up the money for travel and went to the same hospital. Those two kids were very lucky. Treating the walking age child with clubfoot is possible, but it's much more time consuming and costly than treating it in infancy. At Global Clubfoot Initiative, we estimate that today there are more than 2 million children living with untreated clubfoot worldwide. And this is what we want to change through our RunFree2030 strategy and campaign, which is now growing into a global movement. All children have the right to health, well-being, living without discrimination, and to be heard. These children aren't asking for the impossible. They are simply asking to be able to get a treatment that costs less than $500 per child in infancy so that they can wear shoes, run and play with their friends, go to school and live life to their fullest potential. Thank you for that. Thanks for getting those slides up, Catherine, that's great. So let's move on to the next slide now, which brings us back to the RunFree2030 strategy. And my first message about RunFree2030 is that it is urgent. We must act now. More than 200,000 children are born with clubfoot each year. Over 90% of these are in the lower and middle income countries of the world where access to treatment is least available. And as I said, there's over 2 million, by our calculations, living with untreated clubfoot now. So that's children under the age of 18. And as the stories showed, the burden on the children and their families and also society is huge. If clubfoot is not treated, it causes severe lifelong impairment, progressive difficulty in walking, eventually painful sores, and psychological trauma of being bullied and left out. Children aren't able to go to school and later get a job. For society, it means that health and welfare systems must deal with a much more costly and complex issue of untreated clubfoot. Thankfully, all of these burdens are largely preventable through an effective evidence-based treatment that can be delivered almost anywhere in the world. And that's our message. Our second message today is that RunFree2030 is achievable. Why do we believe it's achievable? It's achievable because we have all of the conditions and tools in place now and are poised for rapid scale up of access to treatment worldwide. So what do we have? We have an effective, evidence-based treatment in the Ponseti method that's now considered the gold standard of treatment for clubfoot worldwide. We have a service delivery model that works, and you can see here on the screen the access model, which has the child at the heart, treatment, effective treatment, delivered through a service delivery program that doesn't just include clinical treatment, but includes access, early detection and referral, strategically established clinics, support for parents, logistics and supply chain, and monitoring and evaluation. All of those things are so important. And this model has been refined and proven by our members over the years. And it's able to adapt to environmental factors too. We have the resources in place to support clinical and community training, monitoring and evaluation, and quality improvement. We have a community of parent advocates who are willing to use their voice, and that is so powerful. And we have a coordinated network of NGOs working together with a presence in the 70 countries where more than 90% of all children born with clubfoot in low and middle income countries are born. So geographically, we're incredibly well spread out and coordinated to be able to scale up now and reach our goal. So let's go on to the next slide, please. So this is also illustrated by some of the things that have been achieved to date. And I won't go through all of these. You can find these in the RunFree2030 strategy document, which has just been published on our new website today. But just to highlight a few of the things that have happened over the years that have put us into such a great position as we are now. Between us, we've raised clubfoot as a global health priority with recognition from many different sectors, including maternal and child health, surgical, assistive technology, rehabilitation, disability, and birth defects. So there's much more work to do in that space with advocacy, etc. But clubfoot has gone from a little known condition to something that lots of different influential sectors are talking about. And along with that, we've gained support from professional bodies, local health authorities, governments, and even United Nations agencies to prioritize clubfoot in many countries and globally. Between us as a network, and when I say we, I mean GCI and all of our members, this is definitely not just GCI on our own, we have trained thousands of clinicians in effective treatment of clubfoot, and not just train them as a one-off, but created support, supervision, and mentoring networks to support them as well. We've supported the treatment of hundreds of thousands of children, and each of those children now has the opportunity to contribute economically as well. And we've done some working out of the figures of how much a child can gain in their lifetime earnings through clubfoot treatment. And when you work it out per child, it's about $130,000 that they will gain over the course of their lifetime in earnings potential unleashed by treatment. But when you multiply that number by the number of children that have started treatment, that adds up to $45 billion worth of economic benefit across the course of the lifetime of those children that have already been treated. That's incredibly exciting, and I had to work out those figures a few times because I could hardly believe it when I saw such a big number. And as a network, we've heightened our focus on sustainability and treatment quality with big investments in data, etc. So today we have some really, really exciting breaking news for you, and this shows the latest worldwide progress in the numbers of children starting treatment. And this graph might look unassuming. Can we go to the next slide, please? This graph might look a little bit unassuming, but what I want you to look at is the jump in numbers starting treatment from 2021, when things had stalled a bit due to COVID-19 and a global pandemic. The jump up from there to 2023 of nearly 8,000 cases more enrolled in those 2 years. And this is just absolutely incredible to see such progress. And what we see as we look back to 2005, when we first started monitoring, there was only a handful of countries offering Ponseti treatment then. They were treating less than 1,000 new cases per year. And we fast forward that, not even 20 years, and now we're seeing in 70 countries, more than 40,000 children enrolled each year. So we're seeing that momentum really start to accelerate. And quite a number of countries are now reaching upwards of 50% treatment coverage or close to it. Some of those are Burundi, Cambodia, Ethiopia, the Dominican Republic, Liberia, Kenya, Malawi, Paraguay, Sierra Leone, Rwanda, Sri Lanka, and Tanzania. So congratulations, and we hope to see many more added to that list next time. And globally, we're now up to 20% treatment coverage. And now that might seem a little low to those of you who look at this data regularly. That's because we actually changed the way we calculate the number of cases or children born with clubfoot each year. We changed that based on some new research that came out last year. And that new research actually showed that there was more children born with clubfoot in the world than we previously expected. And so that put the coverage down a little bit. If we'd continued using that old calculation method, we would have been at 25% treatment coverage. Sorry, I think my team is messaging me saying that we need to move on very quickly. So let's move on to the next slide. So how do we get there? Well, I'm not going to say any detail on this. You're very welcome to go and read the document on our website. It's full of detail. But essentially, what needs to happen between now and 2030 is we need to double the numbers of children starting yearly, actually just over more than double them, and we need to double the amount of funding invested. So there's a lot of work to do. We're really looking forward to doing that with all of you and our members. Next slide, please. And this launch today is just the start of a journey, and we hope that all of you will journey with us on this. And the actions that you can take today are to read the strategy and commit to the action that you can take, to sign and share the RunFree2030 statement of support, the video and social media, and we'll place all of those links in the chat afterwards. So thank you for listening, and thank you for being part of this incredible launch today. So now we're going to hear from some of the countries that are already putting this into action. So if I can introduce our next 4 speakers, we've got Dr. Peace from the Straight Child Foundation in Nigeria. We've got Dr. Santosh and Dr. Charu from Cure India. And we've got Samantha Rosales from Hope Walks in Honduras and the Dominican Republic. So thank you for joining us. Over to you, Dr. Peace.
Thank you, Ross. Good day, everyone. I'm sorry my camera is denying you the opportunity to see my beautiful, peaceful face this afternoon. I'll be talking about some of the things that we had done as a Straight Child Foundation to improve access to Clubfoot care among the children in our region and contribute to the RunFree2030. Next slide, please. Next still, this is just my outline. Right, now the Straight Child Foundation was just a product of passion among a group of Nigerian professionals. We saw how things were much better in some places, and we thought we could also do something to improve access to care in our own environment. So the organization is registered as a nonprofit in Nigeria and is focused on childhood deformities and disabilities. Next slide. So previously, Clubfoot care was largely operative and non-Ponseti manipulation and casting. And the health system in Nigeria is an out-of-pocket system, so people have to pay for the care that they receive. The first Ponseti workshop in Nigeria was led by Professor Adegboyinbe in 2009. So that was when Ponseti care was getting popular and Nigeria keyed into this. About 8 years after that, the National Council on Health, which is the largest health decision-making body in Nigeria, adopted this as a gold standard for Clubfoot care in Nigeria. And still on the pathway of improving access, the first partnership between Miracle Fit and a Nigerian partner was born in July 2018. And a month after that, we had the first ACT basic workshop in the country. Now, afterwards, can we have the next slide, please? We found from our experience that the access to Clubfoot care was largely affected by ignorance. A lot of parents who have children born with Clubfoot do not know what the deformity is all about. The health education is not so much available on this condition. The belief system among the people, to a great extent, is that Clubfoot and most other deformities in children are due to supernatural causes, so they did not think of medical treatment for that. And even when people thought of medical treatment, they had to consider the finances, the cost of transport to a place where you have access to care, because the big hospitals where you would have good access to Clubfoot management was lacking in the rural areas. You have them in the big cities, but not in the rural communities. So those in the rural communities would think about the cost of transportation. And when they get to the hospital, they would also think of the cost of getting the consultation, the cost of buying the casting materials, provision of foot abduction braces afterwards. And sometimes, even when some people have the money to buy the foot abduction braces, they may not be available. And the treatment centers are not really adequate considering the population of the country. And in some cases, the access is hindered by distance and the transport system. In many areas, the access roads between the rural communities and the cities are not so good, and the transport system may not be very reliable. So you have all this reducing the ability of parents who have children born with Clubfoot to actually access adequate care. And in the past few years, Nigeria has been hit by the mass exodus of health personnel, and that also affects the care and the availability of people to care for the children with Clubfoot. Now, I talked about the Miracle Fit Straight Child Foundation collaboration. That's a collaboration that started in 2018. We may move on to the next slide, please. It started in 2018, and this partnership supports a comprehensive Clubfoot program. So we have the Ponseti training for healthcare personnel, not just the doctors, but it's a multidisciplinary team. This collaboration also provides for the casting supplies and foot abduction braces, so the parents do not have to worry about having money to buy this. There is support for community awareness activities and trainings on early detection and referrals, and advocacy for Clubfoot care. So these have gone a long way in improving the access. Now, the next slide is also found on the RunFree2030 document, so I wouldn't spend so much time on this, but on the next one, we'll talk about what we have been doing using the access model of Clubfoot care. Now, for the service delivery, we've worked in collaboration with public health institutions in Nigeria to make Clubfoot care more easily accessible. Because of the collaboration with Miracle Fit and the provision of the treatment materials, a lot of people are able to access care without bothering about the financial burden. The early detection and referral trainings to health workers in the rural communities has also improved the number of people who come from those rural communities. At least the problem of ignorance is being solved. Health education is more available than it used to be previously. There are many strategically established clinics, not just in the big cities, but in some local communities. We are still working to improve the number of those clinics. There are skilled clinicians, but more are being trained. I'll soon tell us the number of ACT trainings that we've had in the country. There's a reliable supply chain. The treatment is monitored and evaluated. So the audit helps us to ensure that quality treatment is maintained. And very indigent families who do not have money for their transport actually get a stipend to enable them take their children to the clinics. The casting materials, sternotomy support, braces are all readily available, and this is improving the long-term adherence to treatment. I've talked about the awareness. More partnerships are being built. We are working on the political will. Today being the World Clubfoot Day, in different states, we had partnered with the National Primary Healthcare Development Agency as a way of having a buy-in so that we can collaborate with them to do more of the Clubfoot surveillance as part of the birth defect surveillance that is ongoing in the country. So that is actually working a lot. And the next slide will show us some of the results that we have had. In the past 6 years or thereabouts that we have had this collaboration with Miracle Fit, 2,277 patients have been enrolled as new patients into the Clubfoot program. 1,155 sternotomies have been performed, and that's going to improve in the days coming because more clinicians are buying into having sternotomies for practically every child. Currently, we have 1,665 patients on foot abduction braces. They don't have to worry how the braces come. Miracle Fit supplies us the braces, and when a child outgrows a particular brace, the parents bring him back for another size, so they don't have to worry about that. So we have conducted 16 basic Ponseti workshops and 11 advanced ACT workshops based on the ACT curriculum. More than 270 healthcare providers of different cadres and designations have been trained, and more than 8,000 healthcare workers in the rural communities have also benefited from the early detection and referral trainings. Some of us were also part of the delayed presenting Clubfoot workshop in Addis Ababa, Ethiopia, held recently. So a lot is being done to not just to ensure that the access is there, but also to keep improving on the quality of care that we receive. As at May 17, 2024, the Straight Child Foundation on the Miracle Fit sales dashboard has on the next slide, we have what it looked like in terms of statistics. In May only, we recorded another 96 new enrollments just in about 10 states of Nigeria. And as we can see, all the spaces are colored green. That shows that these children are not just accessing Ponseti care, but they are accessing quality Ponseti care according to the global standard of care. Now, what strategy have we been using to do this? We have advocacy to stakeholders and policymakers. Like I said earlier, we are using today the World Clubfoot Day to expand our work among the agencies that actually are in charge of public health in Nigeria. We conduct public health education and refresher trainings for the providers, and as well as for the communities as well. Next slide, please. We have regular community awareness and EDL trainings. Transport subsidies are provided to indigent parents, and we have collaborations with other professional bodies, civil society organizations, government agencies. So partnering with the Society of Gynecologists and Obstetricians in Nigeria to help improve education to the mothers and their partners. So a lot really is being done. And we have planned a population-based Clubfoot surveillance as part of the birth defect surveillance that is being supported by the Federal Ministry of Nigeria. And we hope that this would actually help us to get to the very rural areas where access would have been very, very difficult. The next slide shows a graph of is a map of Nigeria, and has different colors to see the different partners and the states that they cover. So this shows that all the states in Nigeria are being covered or are in the process of being covered. So Miracle Fit has 3 implementing partners in Nigeria, and currently these 3 partners are working in 45 clinics across 24 states in Nigeria. We are hopeful that in the next 1 or 2 years, the remaining states would also be covered. And in this current year, the fiscal year of Miracle Fit is from July till June. So in FY24 only, 1,500 new patients have been enrolled for Clubfoot care across the country. And the very last slide, if you would move on, will show a child and her family. This child was born to a mother who had a deformity. No, the next slide, please. The mother had a deformity in her upper limb. The child had bilateral clubfoot. And when we started the collaboration, the mother got to know about this through one of the community awareness activities and brought her child to the hospital. You know, she had suffered stigmatization. They had called her names. They had called her a witch because she had a deformity, and her daughter also had a deformity. And for the young child, she had a desire to wear shoes like every other child. Maggie talked about that when she told her story. And you know, when this child was treated, the mother did not have money. So it was a very big relief to her that we had a support that made the care readily available. And we can see her smiling, and you'd also see the smiles on the family members. So the access is ongoing. We are widening that, and we are bringing smiles to lots of children in Nigeria. And we are really excited about that. We are happy to be part of this move to eradicate the disability from Clubfoot by 2030. We are happy to support the RunFree2030 movement. Thank you.
Thank you, that was brilliant. We'll now move on to Dr. Santosh and Charu to tell us about what's happening in India.
Wonderful. Thank you, Rose, and thank you everyone in GCI network. It's truly an honor to talk about what is happening in India in the last 15 years. Next slide, please. So when we started this program 15 years ago, 2009, our only desire was to establish designated weekly Clubfoot clinics. And as an organization, Cure India, we decided to work with the public health system in India, the government hospitals. And today, after 15 years, we are truly convinced we took the right path. We started working with different states. There are 29 different states in India. We started with Delhi, the national capital, and then we started gradually expanding our program to different states. If you look at this different map, you know, we started growing gradually. Started with 1 state, 7 states, 14, and by 2016, we as an organization signed agreement with all the 29 states. We gradually grew. Next slide, please. We received a recognition at the national level when we organized the first global Clubfoot conference. We had the Honorable President of India come, and the President of India declared that organizations like Cure India should do everything possible that every child born with clubfoot should receive treatment. So that was a big recognition for us, and it was a great opportunity for us to move forward. This meeting, when we had the first Global Clubfoot Conference, Ross was there. She endorsed. The next slide. It was such a great journey from then onward. Yeah, the next slide. Yeah, this is when we had the ICRC regional head. We had the Rotary International, the Rotary Foundation representative. We had the Honorable President of India. We had the Health Minister, Health Secretary, and you can also see Ross representing GCI and endorsing and supporting our program. Next slide. Today, we had really very meaningful World Clubfoot Day celebration, not just in Delhi. We had this celebration all over India. We started a 10 days celebration because it takes time for us to complete the celebration in all the clinics. So we had the Government of India officials come and inaugurate it, and it's such a great joy. I was just looking at the reports coming from all the states. Extraordinary celebration. Parents celebrating the World Clubfoot Day, doctors, government officials, the public. It's a festive mood in India, and it took 15 years for us to create this kind of movement. Next one. After 10 days of World Clubfoot Day celebration, on 12th of June, we will be officially launching the India RunFree2030. We already have confirmation from the Health Secretary, Government of India, to come and launch this. And everyone is actually taking it very seriously. The 2030 milestone. The goal is how to make sure that there is at least one treatment center in every one of the districts. We have 806 districts, county, in India, and in every district we want to make sure that there is at least one treatment center, so that every child born with clubfoot has access for treatment. Next slide. The strength of our program is the Cure India model. As an organization, we always keep the child at the center. They are the first priority for us, children born with clubfoot. And the guesstimate is around 40 to 50,000 children are born with the clubfoot in India every year. So we are very fortunate that we have so many partners. We have not mentioned all of them. Charu is here, will be talking about how ICRC has been partnering with Cure India in the last 10 years. We have the National Child Health Policy, the RBSK program, partnering with us. And their role is identifying children with clubfoot and referring them to the Cure India program. Parents are our extraordinary strength. We are very fortunate that we have more than 400 parent support group that really encourage, support the younger parents, and that's the strength of our program. Doctors, we have nearly 9,000 doctors who are part of our program, who underwent the training on the consultative method. I'm very happy Dr. Alarik Arujis is here in this meeting, who has been a great help from the time we started this program. He's been helping us as a faculty. So doctors are a great support for us. Rotary Club, again, a great support. We have 5,000 Rotary clubs in India. And Rotary in India has this great history of eliminating polio in India. So now that for the last 10 years, there is no polio in India, Rotary has taken Clubfoot as the next big agenda for Rotary. We have the National Health Mission, the Government of India initiative supporting. We have different departments of Government of India supporting us. All these things put together is the Cure India model. We are not alone. As an organization, we cannot. You also see CSR, it's a corporate social responsibility fund that we receive. When we started this program 15 years ago, almost 95% of our funding was coming from outside India. But today, the support we have from outside India is less than 1%. So we raise funds for supporting our children within India. So we survived because of this complete turnaround, and we are sustaining this program with support from India. Next slide. So if you look at our impact in the last 15 years, if you look at the number of children, we have 106,000 children in the program. Every month, we are adding at least an average of 1,000 children added to our program. If you look at the year 2023-24, we have 12,527 children. We have 130 training programs we did so far. And we have nearly 9,000 doctors who have gone through this training program. More than 424,000 braces distributed. And if you look at the total impact, the community health volunteers, the parents, the children, the doctors put together, more than 637,000 individuals are the beneficiaries of this extraordinary program. They are very determined. Now we feel that we can achieve. It was very difficult for us to come to this clarity maybe 15 years ago. But today, with the support of government, doctors, parents, partners, we are able to tell that soon we will create a network of clinics in India. We will create a network of committed doctors who have the ability to provide quality treatment. Soon we will see India free of disability from Clubfoot. We are so excited that we are part of the Global Clubfoot Initiative. We truly appreciate the support, the inspiration, the guidance we get, and we look forward to a great partnership. And today, on this World Clubfoot Day, it's truly an honor talking about what we could do together. And I'm sure Charu will have some more points to add.
Thank you, Dr. Santosh. Hello, very good evening from India, Delhi. So again, as Dr. Santosh mentioned, I would also want to congratulate everyone on World Clubfoot Day. And today I was actually with Santosh when we had this very good celebration of World Clubfoot Day in Delhi. So now talking about a couple of points from International Committee of the Red Cross, so which I am representing today. So we have partnered with Cure. It's been a decade now, and I would say that this partnership has been very successful in terms of the kind of support which we supported to Cure, and also the kind of response which we have received from Cure and the government as well. So our partnership was in a couple of states in India, and under which we supported the organization of the training for the doctors on paucity, training for counselors who are the ones who make sure the follow-up on bracing happens on time, do parent counseling, and also provision of food apprehension braces free of cost. So I think these are the thematics which we were really focused upon. Apart from that, talking about the sustainability of this project, we made sure the resource mobilization was also one of the components which we supported early on. I think what makes Cure unique is this public-private partnership, which Santosh mentioned at the beginning. In a very short span of time, talking about a country like India, Cure is there in all the states. So I think it's a big achievement, and understanding the context and the complexity of a huge country with the kind of diversity we have. So I would say to what Rose actually mentioned when she was talking about the key points of RunFree 2030, the focus on access to services, quality, and the integration which is linked to sustainability. These are also one of some of the strong points which we also focus upon. And I hope under this initiative of RunFree 2030 of GCI, we'll be able to contribute and make sure that we are able to reduce or eliminate the disability caused by clubfoot in India. Thank you. Over to you.
That was brilliant. Thank you so much. And so exciting to see your maps with all the progress and expansion that you are making there. So thank you. We'll have Samantha Rosales next to report from Honduras and the Dominican Republic. Thank you, Samantha.
Hi, thank you very much for the opportunity. Really excited to be part of this webinar, and I'm excited to be sharing a little bit about how we are measuring quality in Latin America. Indeed, Honduras, DR, and also we will be talking a little bit about Haiti. Guided by the principles of RunFree2030, Hope's mission is to free children and families from the burden of clubfoot disability. And in line with the 2030 strategy, we've aimed for widespread uptake of the access model. Next. A little bit about as an introduction on Hope's Latin America and its partners. In Honduras, we partner with La Comisión de Acción Social Menonita. In Dominican Republic, we are partnered with Hospital Good Samaritan. And in Haiti, we partner with Adventist Hospital. So these partners provide a contextual specific strategy and an input on how we can support reach within each individual country. And they help strengthen our relationships with the national ministries of health. Next. RunFree's 2030 Strategic Action 3 is to enhance quality of service provision. And as we scale up within Latin America, we aim to assure first that families have access to Panseri care, 2, that clinics have enough Panseri trained providers, and 3, that the monitoring and evaluation systems are in place to ensure high quality standards. So now I'm going to be talking a little bit about some examples on LA, and this is how we are working towards the success indicators in Latin America. Next. Okay, so we have adopted the access model, which is designed for replication across various regions and countries. And we as Hopebox, we have implemented this model in each of our countries, but tailoring it to suit the unique context and settings. So the X integrated into public hospitals within also regional services, talking about DR. And also this is like to focus and to address the entire population. And within the logistical support, hope no kid is left behind. Talking a little bit about how our clinics are strategically position also within Latin America, we are working in collaboration with the Ministry of Health, and this ensures easy access and sustainability within the public healthcare models. Early identification. We've collaborated with the directors of the Dominican Republic Hospital and in Haiti also, as we are involved in training the personnel. We conduct sensitization visits. We engage in EDRs with pediatricians, gynecologists, obstetricians, and these to enhance awareness. Also, our outreach initiatives, they include media campaigns, which these have resulted in a really big increase of awareness among the families. As a result, now they contact us directly to each of our clinics after seeing the coverage that we have in the news or that we encounter through pasting posters. Referral pathways. Efforts in Latin America have been concentrated, as we were saying, in improving how to ensure efficient treatment. So we've collaborated with the MOH, and our focus has been on facilitating immediate assistance for newborns in our partner clinics where we have maternity wards. However, there's still like some room for growth in these areas across our 3 LA countries. Human resources. In each of our clinics, we ensure adherence to our KPI of having 2 or more trained providers. In Honduras, orthopedic surgeons incorporate compensated method training into the postgraduate student classes. And additionally to this, we do ACT trainings. We prioritize the staff who is new and the interns who are rotating. This through all of our clinics so we can ensure ongoing skill development. About supply chain. Through our partnerships, we work with Clubfoot Solutions and MD Orthopedics. Hobox has ensured affordable Clubfoot braces. This way, we've been improving accessibility to cost-effective materials. But despite some contextual challenges in Haiti, we've been able to distribute to the different hospitals the materials thanks to our ongoing efforts. Integrated coordination, as I've said, we work side by side with the Ministries of Health in Latin America, and this has facilitated the recognition of the program. In the Dominican Republic, some members of the Orthopedic Association have proposed a public policy for recognizing Clubfoot as a first-level service. And long-term follow-up, in LA, we have parent advisors who are the ones who support the follow-up of children. And how they do this by being present on the clinics, by phone calls, and by home visits. This way they ensure the continuity of the care, the monitoring outcome. And this way also we are entering data into PATH directly by our parent advisors. This way we could measure some of our KPIs, such as casting and also tenotomy rates. And monitoring and evaluation, the Hobox Path Tracker Capture platform is a centralized system where parent advisors input detailed information about each kid's journey. They can follow up through every appointment. And this way we can also get some reports. Next slide. Okay, so now getting deeper into DR in 2023, DR achieved a 64% of access rate to care with a specific focus on understanding patient demographics. We are now working with a system in which through mapping, we can see where patients are located. And through this way, we can provide some different insights. And this can help us also in strategic planning, such as EDR trainings and where we can open new clinics. Next slide. Now in Honduras, last year we faced some challenges like tropical storms. But something important to recall in here is that despite all these challenges, we've been able to commit to the comprehensive care. How? we collaborated with our partner, with CAS, Comisión de Acción Social Menonita, and we utilize our data from PATH to identify these families and to give them immediate support, these families who were affected by the storms. So we ensure that through our dedication to quality care, care persists even in times of adversity. And additionally, we work to raise awareness, particularly to adults and youth, so they can be informed that the availability of early access care and free treatment is throughout all the country. Next slide. And overall, with our new PATH data system, we're able to monitor some indicators which align with GCI's indicators. Some of them, just to mention them: access to care, less than 8 CAS, 90% tenotomy rate, first brace, and bracing until 5 years. Next. And in Haiti also, we've been able to deliver in quality care, even though it's been challenging. And because of some areas are going through conflicts. Despite all these obstacles, the medical director from Haiti, Dr. Jackie, he recognized the need to support the clinicians in hard to reach clinics. And what he did is that he created an instructional video to enhance care quality. So this strategy demonstrates how a commitment to maintain the standards, despite all these challenges, can contribute to the quality of care. So, however, all these impacts that Haiti is going through, we had to suspend one of our clinics, one of our 5 clinics. Now we just have 4. But even though healthcare providers are still dedicated to the quality of care, and through the adaptation and the resilience efforts, we've been able to provide this care. Next. Okay, so our journey, next, please. You can see the text. Okay. Our journey to measure the quality of Clubfoot care in LA under the RunFree2030 initiative has been characterized by dedication, by collaboration, guided by the access model, and all of these incorporating the comprehensive trainings. We've located strategically our clinics, and we've employed also our data-driven approach. We've been doing this through monitoring and evaluation systems, and these have helped us to continue our high treatment quality standards. So by maintaining our commitment to quality together, we can continue to work towards a future where every kid has the opportunity to run free. Thank you.
Fantastic. Thank you so much, Samantha. That was brilliant. I'm now going to hand over to Jen and Dr. Gonzaga.
Thank you, Roz. I'll be talking to Dr. Ed Gonzaga today. He is the municipality officer from the Canton municipality in the Rizal province of the Philippines. And he and his government office have been collaborating with the Philippines National Clubfoot program, PNGOC, and Miracle Feet to make sure that all children in his province have treatment that they need for Clubfoot. So welcome, Dr. Gonzaga. Happy World Clubfoot Day.
Hey, good evening, everyone.
Dr. Gonzaga, I'll just get us started with a couple of questions. Could you tell us, as a municipal health officer, how did you come to support the Clubfoot program?
The Philippines is now in an exciting phase of universal healthcare. It has been 5 years, and the essence of universal healthcare, promotive, preventive, curative, rehabilitative, and palliative healthcare. I have attended a strategic meeting with PNGOC and Medical Kit, and I saw it's a good thing for our municipality to establish a Clubfoot clinic. So I want our constituents to have an access to this kind of services because we are also seeing patients with this deformity. So I think establishing a Clubfoot clinic that will definitely help our constituents and their families. And that's why I came to be interested to set up the clinic right here in the part of the country.
Thank you. And could you tell us, actually, first, if I could just pause for a moment, I think your sound is just you're having some technology problems. I'm not sure if maybe you could speak into the microphone a little closer, but we'll proceed. Could you tell us how the Clubfoot program has integrated within the local health system?
Okay, we are integrating it in our local health systems, no? We have about 31 health centers, and we are involved in the health education and promotion, identification, assessment, referral, optimum care and treatment, and eventually we'll be doing follow-ups and family counseling for those families with children affected with Clubfoot. And that's how we can see the integration later on once we have established our Clubfoot clinic.
And what does this collaboration and this initiative mean for the people living in your municipality?
Of course, they will look at it that our healthcare is responsive to their needs, no? Looking at the essence of universal healthcare, we don't want them struggling and having financial hardships in handling the cost of the care, and that will be given for free to them until they will be cured and they
And finally, could you just address how is the health system in your municipality ensuring quality treatment? Dr. Gonzaga, I think maybe you went on mute. We can't hear you.
Okay, can you hear me now?
Yes, and so the last question was how is the health system in your municipality ensuring that Clubfoot treatment is of quality?
Of course, the proper collaboration with experts, with PNGOC, who are my friends, and Miracle Kit, the proper guidance and in the integration of the Clubfoot program in our health system will definitely help to ensure the quality treatment and management of Clubfoot. Overall, the setting up the Clubfoot clinic in this municipality is guided by the right people, such as the expert in the field, and those organizations who have been involved in the program before me with proper collaboration and integration. It will not be a failure at all, I could see. So the Clubfoot program will definitely be a success. More so, we shared to our people and to our constituent excellent option how we can take care of their children, the affected family, to become normal and in the end, improve their quality of life. I believe if we have improved the qualities of the lives of the children affected by this deformity, that I can say that integration of the Clubfoot program, we have achieved our purpose and goal. And I am very affirmative that it will happen soon. With your guidance, of course, in that part of the world. Okay? Thank you so much.
Thank you very much for sharing your experience and especially for sharing the perspective from the government. Thank you. Next slide, please. And so now I just briefly wanted to touch on RunFree's call to action. It's been so encouraging to hear from different countries and representatives. There's already so much momentum, and we are certainly on track to meet RunFree 2030 goals. We hope that these inspire others to answer RunFree's call to action, which is to rapidly scale up clubfoot treatment worldwide so that children with clubfoot born now, born in the past decade and in the future decade will have access to the treatment they need so that they can prevent an unavoidable disability. Next slide, please. I won't be going into details about the call to action because of time constraints. I would highly encourage you to read the RunFree 2030 strategy. It provides a framework that describes how we can rapidly scale clubfoot treatment services through 4 cross-cutting strategies. These strategies need to be carried out in partnership with governments, with civil society organization, and other institutional stakeholders. So collaboration and partnership is essential. The 4 strategies that we describe in detail in the document in the RunFree strategy are expanding geographical reach while deepening coverage. So we want every low and middle income country to provide clubfoot treatment services. There are still 11 countries that do not have evidence of clubfoot treatment, and we want to make sure that all countries have treatment and that countries that do have treatment are going deeper into coverage, that each country at least is able to reach 50% for our next milestone of RunFree 2030. We also feel that it is very urgent to raise the profile of clubfoot as a public health priority. There are SDGs and several global health initiatives that have clear alignments with clubfoot treatment, and we need to make that more visible so that government policies and budgets are that we start to see those government policies and budgets that should be in place for children. We also need to enhance quality of service provision. So as we scale up, we know that quality is sometimes risky because we're moving quickly. And so we need to make sure that all hospitals within health systems are following the Ponseti method, which is the global standard. Monitoring and evaluation systems need to be in place. And the workforce needs to have regular training and mentoring so that they are always available with strong clinical skills to treat children. And finally, something that has been threaded through each presentation is that it is essential, absolutely essential, that clubfoot service delivery and the access model is integrated within existing health systems. So, and you've heard many examples of those today. The actions that I've just briefly talked about in these strategies and our colleagues have mentioned throughout the presentations, they are aimed at government authorities and policymakers because it is imperative that that they are integrated within systems so that they are sustainable. And while the government institutions hold primary responsibility. Other institutions, educational institutions, large public health institutes, and smaller civil society organizations also have an opportunity and the responsibility to integrate Clubfoot within their initiatives. So RunFree2030 recognizes the challenges to do this, but we take the long view. We do believe that over time, Clubfoot services can be embedded within health systems, within different educational or healthcare institutes. And while that progress has taken time and will take time, we want to accelerate that because the partnerships and collaborations that are capable of responding to this call to action are it's the backbone of this work. And eventually this call to rapidly scale up services, we believe, will lead to a sustainable care for children with Clubfoot in low and middle income countries. So thank you so much for being here today. And for those of you who have already responded to this call to action, we know that many are strategizing on how they can accelerate. For those who are not currently working in Clubfoot service delivery, we invite you to be part of this movement. And in closing, I invite two friends and colleagues to share a few words. Dr. Jim Turner, who is representing BISCOS, the British Society for Children's Orthopedic Surgery, and Dr. Alaric, who is representing POSI, the Pediatric Society of India. Over to you, Dr. Turner.
Thank you for that, Jen. Yeah, just like to say a few words. My name is Jim Turner. I'm a children's orthopedic surgeon in the UK, and I would like just to sort of share my support really on behalf of BISCOS. From the point of view of BISCOS, a network of around 400 surgeons and allied healthcare professionals, we support this initiative because we can see how sustainable programs in every corner of the globe will significantly reduce the number of children and adults living with the deformity and negate the effects it has on their physical and psychological well-being. Slide change. We recently, but you can see there in 2021, we underwent a consensus process and we published guidelines on the treatment of Clubfoot, which are very much aligned with the quality indicators that you have out, or we have out, for RunFree2030 and the ACT training content, both of which are building blocks for this project. Slide change. Many British orthopedic surgeons have championed Clubfoot treatment in LMICs as clinicians and trainers, as it has been brilliant to see how over time capacity has grown for excellent quality treatment in those countries. And you can see Dr. Alaric in this, this photograph. Slide change. So yeah, in UK practice, there's much to be learned from how LMIC countries have organised themselves to provide Clubfoot treatment on a national and global level, such as creating effective mentorship links and collaborations. And these points I know have been mentioned on a few occasions before by other people on this webinar. As a family of clinicians dedicated to excellence in children's orthopedic practice, we wholeheartedly give our support to this global initiative and the life-changing, and we say far-reaching impact it will have to children all over the world. Thank you very much.
Thanks, Dr. Jim. Dr. Alaric.
Yes, hi, thanks, Jen. And it's great to see all of you here today. It's fascinating to have so many different from across the world and experiences of so many experts who have been working tirelessly in the field of clubfoot care. My name is Alaric Arujus. I'm a pediatric orthopedic surgeon from India. And today I'm here in my capacity as the president of the Pediatric Orthopedic Society of India, which comprises of about 750 orthopedic surgeons who have an interest in clubfoot. India was one of the earliest countries to adopt the Ponseti method of clubfoot care since 2002. And we've had several training programs through the Cure India network and also through our own organization as part of our various conferences and other webinars and other educational events. I'm here today in my capacity as the president of POSI to pledge support to RunFree2030. It's a wonderful initiative that really has taken the world by storm. And I think the way POSI can collaborate with GCI and the various other organizations under its umbrella is to create more awareness in India and our neighboring countries in the subcontinent, to have various co-branded webinars and other educational events, and also to offer ourselves as a society to conduct training courses, not only in India, as we've been doing over the last 20 years, but also in the other countries in the surrounding region. Thank you everyone for being here today. I know it's been a long day and the celebrations are still on, but wishing all of you a very happy Clubfoot Day. Thank you very much.
Fantastic. Thank you both so much, Dr. Jim and Dr. Alaric, for those messages of support. It's incredible to have such strong support from professional bodies like yours that show such leadership in this space. So thank you both. So we're wrapping up now, and thank you all for your perseverance. I know we've overrun a little way, but I think it was worth it to hear all these incredible stories of progress from around the world and how this RunFree2030 is being implemented and put into action. So today we've heard that RunFree2030 is both urgent and achievable. We have 7 years to 2030 to more than double our efforts. So it's going to mean that we're all going to need to work hard and work together to support each other to reach our goals. We've heard from people living with Clubfoot, their families, NGOs, clinicians, from government and professional bodies, all in support of the goals of RunFree. And thank you to all of our fantastic speakers who shared their support. We welcome all of your involvement as we take this forward together. There's several actions you can take today. As we said, they're just the start of a journey. Please get signed up to our newsletters, social media, be part of it, and let's journey together towards our big goal of RunFree2030. Thank you so much, everyone.
Thank you, Ross.
Every 3 minutes, a baby is born with clubfoot. That's nearly 200,000 babies each year. Clubfoot is a birth defect that can easily be corrected. But each year, 80% of babies born with clubfoot are not treated because they live in countries where there's limited or no access to proper treatment. As they grow, these children face pain, discrimination, and rejection, with little hope for their future, a future free from disability.
We want a world where every child born with clubfoot can run free from disability by 2030. As a global clubfoot community, we've developed RunFree2030, a strategy to end clubfoot as a lifelong disability. Through our service delivery model, hundreds of thousands of babies have already been treated.
Clubfoot treatment is simple and inexpensive, and RunFree2030 calls for it to be available in more clinics in all countries around the world. We provide high-quality training to clinicians and monitor treatment outcomes, so we know that babies get the best possible treatment.
We partner with national healthcare systems to make sure that their health workers have the skills they need, that clinics are always well stocked and close to the children who need them, and that families have the long-term support they need so their babies grow into healthy children with bright futures.
We need your help too. Join us. Make it possible for all children to run free by 2030.
Thank you, everyone. We're going to say goodbye now. We'll be following up with the links to everything we've shared today. And a final very big thank you to all of our panelists today. You've been absolutely fantastic and very inspirational. So thank you and goodbye.